Welcome. This is the Global Summit House Podcast. Catch power interviews and discussions with influential, inspiring, and powerful people. Explore what's possible by tuning into this podcast with our all-new The Writers Project episodes, featuring one of the world's most inspired thinkers and writers. Visit our website at www.globalsummithouse.com.
We are back live here on our Sunday radio broadcast, coast to coast and border to border on TuneIn, iTunes, Radio Loyalty, and of course, we have got some fun stuff coming up here in a few moments. But before we do that, we have got a great guest joining us on the telephone. And go ahead and introduce yourself, my friend, and talk to us a little bit about yourself.
Okay, I'm Jerry Rhoads. I'm sitting here in the Chicago suburbs. I'm a CPA. I'm a fellow in the American College of Healthcare Administrators, licensed healthcare administrator. And I have, last count, 57 years of experience in healthcare services and systems, mainly as an entrepreneur and developer of software systems.
Now, you have written a series of great books. Talk to us a little bit about these books, my friend.
Well, there are 9 in total. Most of them were written while I was operating either our consulting business for hospitals and nursing homes, or then we bought 3 nursing homes, one in Arkansas, 2 in Iowa. And the main book that I'd like to talk about today is the one about failing government taketh away, which relates to the problems we had in trying to manage our nursing homes. And the other one is, I call it the American Enterprise Manifesto, but it really is about the political quagmire. And I've got, within that book, I have a proposed solution. And I have, in these books, I map out the problems, back them with facts, and then tie them into solutions. So I guess what I'm thinking I'm going to cover today would be some of the major problems and what are the solutions.
Fantastic. So tell us about some of the different problems that you think are out there.
Well, let's relate it to healthcare first.
Okay. Start there.
You know, we have this talk about Medicare for all, and do we have affordable health care? And so in my, and not opinion, but analysis, we base health care on input, not on output. We pay the providers their incomes, but we don't really get expected outcomes. And I guess the way I arrived at that is that in 1962, I took a job out of college with Arthur Andersen, which is the largest accounting firm. They brought me from a small town in Iowa to Chicago and told me I was going to be a consultant in healthcare. Well, that was the start, so they sent me out to hospitals, and we were supposed to bless their cost reports so they could get paid by Blue Cross for services. And they based that on a one-page summary of their departmental costs and had no relationship then to the services they provided. And we just had to go back to the records and make sure that that one-page document was accurate, and then Blue Cross would pay the hospital based upon the number of patients that they had, plus the 5% markup. Well, over the decade of the 60s, there was legislation passed called the Medicare, the amendment to the Social Security Act for Medicare and Medicaid. That was 1964. And I just happened to be assigned to Blue Cross, so they picked a few of us that told them we're going to roll out Medicare with the hospitals. And so they picked out some demonstration projects, and
yes,
we took time to go in and tell the hospitals they were going to have to report their costs back. Well, they only had departmental costs. They didn't have costs that related to the services of the patient. But to make a long story short, all of this started with my assignment to Blue Cross and then the Medicare. So basically, I've been working with the government and the providers for 57 years. And the problem is they're not paid for outcomes. There is no way to major healthcare providers account and make them accountable for their costs in relation to what the services they're providing, because they're getting paid for a diagnosis or a prescription or an encounter. A physician gets paid for an encounter, most of which is when he goes to the hospital. And there is no link to what are we getting for our money. And that is not an issue, it's a problem. Because now we have $3 trillion that are spent on providing health care, including pharmaceuticals. And there is it's all about treatment and pills, not about services and what did we get for our money. Well, the government in this instance is what I would call a monopsony. And a monopsony is the opposite of a monopoly. We all have played the game of Monopoly, and if you can monopolize the corners and the more the properties, the better, you win Monopoly, because you monopolize the board. Monopsony is the opposite. It's where the buyer has all the sellers, and they control the gold, so to speak. Those with the gold rule the board. So in a monopsony, with the federal government buying 75% of the healthcare services without any link to outcomes, and the insurance companies are basically handling most of the managed care contracts, 100% of our healthcare is on the basis of this model. And so my books are written proving my premise. And first of all, if you go to the debt clock, have you heard of the debt clock?
Yes. Yes, we have. Explain that to us.
Well, the debt clock is in New York City. It's on the wall of the Chamber of Commerce building, and it only shows you the tip of the iceberg, I call it. But that is the country's total obligations, debt, on the accrual basis or generally accepted accounting principles, which the government's books are not on. They're on the cash basis. They're basically cooking the books and not recording all of the debt. The debt is $123 trillion, not $22 trillion. Okay, so if you go in and watch these numbers grow, and they're all built on algorithms that were developed by how the budget works, you will see that everything in there, including the expenditures to Medicare and Medicaid, are on a cash basis. And in many cases, the government accelerates the income, the revenue from income taxes by requiring estimates to be paid on the next year. So they're accelerating revenue and deferring costs. And so what we have in the big picture, if you recorded all of the liabilities, we would have enough assets to cover the liabilities. They also show the number of assets, the gross national product, all kinds of information in the debt clock. Is it reliable? Well, in my opinion, it's taking us from cooking the books to getting the books reflecting where we are. Because no one knows unless somebody shows them. You know, that's kind of the premise of my book. No one knows what they don't know. And so within that debt clock, there are also state debt clocks. So in effect, when you look at this, each state is insolvent as well as the federal government. Why is this? Well, we have 22 million government workers, employees. and they all had health care. They got better health care than you or I. They get paid on an average of $55,000 a year, whereas the private sector is $45,000 a year. That's all employees. For federal government workers, they get an average of $125,000 a year. So then, what this does, of course, is further sink us into the swamp, as it's been called, and we're not doing anything to stop it. I mean, in a business, insolvency means you're going to go bankrupt. So you better reorganize your debts, get equity in, pay down the debt, so you can service your long-term debt. I guess, am I making myself kind of...
Yes, you are. Yes, you are. Well, tell us a little bit more about this this book that you've written here.
Okay, the first one is a chronological diary of our investment in our nursing homes. I call it Failing Government Takethaway because we got into those nursing homes with the idea that we would take our software that we had developed and used in our consulting business to enable us to get the Medicare money that the government's supposed to pay. They're supposed to pay 100 days on each spell of illness for patients that go from the hospital to the nursing home. Well, they use denials to say we're not going to pay any more than 20 days unless you can prove to us that there's continuing medical diagnosis or necessity to get the 100 days. Well, we developed software to prove that we were providing rehabilitation and restorative service during the 100-day period, getting them better and sending them home. Under the 20 days, you're not going to get many people coming out of the hospital with 3 or 4 or 5 things chronically wrong and get them back home. So we designed a system where we would provide better services, but we expected the Medicare program to pay us for the time it took. Well, we're denying not only our claims, but other nursing homes' claims. Other nursing homes decided they weren't going to put them on Medicare. They would take them off Medicare in 20 days, put them on Medicaid, which means they're going to not get rehab, they're not going to get restored, or they're going to be in that nursing home for the remainder of their life. And we really turned them into the Medicare patients and the private patients into Medicaid because there's a spend-down requirement. So if you're in the nursing home, you get 20 days Medicare, you go on private resources, you spend all your money. It's called spend-down. At $5,000-6,000 a month, it doesn't last long. Then you can go on Medicaid, which means the state and federal government will pay for your care, and all you have left is a death benefit, a burial benefit. Family isn't obligated, so we have, in 16,000 nursing homes, we have about 1.5 million people, 3 million in total, 1.5 million on Medicaid. That's growing because we have 77 million baby boomers that were born between 46 and 64 that are reaching the age of Social Security. 10,000 are going on Social Security a day. 7,000 are going on Medicare a day. So what we've built in here is not only we're not properly servicing the Medicare beneficiaries as it is, we're telling them a lie. There was never anything in the rules, regulations, or the law that said that we had to get them better. They've used that medical necessity thing to prevent us in the nursing home business, the skilled nursing facilities, from being able to rehab and restore people. And it's because they're paying on an assessment instrument that's faulty, and that would be input. They're not paying us on getting people better and getting them home. If that was the method, we wouldn't have as many people stuck in nursing homes. And we're going to need more nursing homes because we've got 77 million people. At least some of them are going to have nursing homes. So that's what that book's about, and how the 3 nursing homes that we put this in, we were discharging 57% of those that we admitted. It was working, and we had the surveyors all over us because I had gone to the governor and suggested that we collaborate and try to put my methods in these homes and then take it to rural nursing homes because they're closing and I would have a